Joining me now to discuss this from Valencia, Spain, is Dr. Peter Chin-Hong, a professor of medicine with the University of California, San Francisco. Good to see you again. Thanks so much for being here with us. So it sounds as though only certain people in certain age groups and with specific risks will be able to easily get the shot. So exactly who qualifies? And when it comes to those risks, I mean, how are they supposed to actually prove it?
Yeah, so who qualifies? What's staying the same as those who are 65 and older, those who are under 65 with a comorbidity, including those over 6 months, and those under 18 months. But the problem with the under 18-year age group is that they have to have a discussion with a healthcare provider. So what is this setting up is really just a lot of barriers. You have to have a healthcare provider, even if you're in the eligible group. Maybe you heard rumors that your kids couldn't get the vaccine. So why try? Because you're worried about a $200 payment at Walgreens. Right now, the CDC advisory board hasn't met. So if the drugstore is waiting for the CDC advisory board to meet, and that is very uncharacteristically several weeks after the FDA approval, I think there's a lot of uncertainty.
Yeah, absolutely. And certainly just anecdotally, a lot of people have come to me asking me questions about this because nobody seems to know whether it'll be covered and whether they can actually get it. I mean, you used to be able to just walk into a pharmacy and get a shot. Now, as you say, so many hoops for people to go through, and an adult without insurance, that $200 figure you mentioned, that's what it'll cost you if it isn't covered. So what effect do you think this will have on the population with so many people possibly not getting the shot?
Well, I think it will have a demonstrable effect with an increase in hospitalizations in some of the groups that are not covered that are higher risk, like those under 2 years old, who have to, again, have a healthcare provider, those who are pregnant, who are healthy, because right now they're not incorporated in the rules. And we know that that's an age group, or that's a risk group at higher complication rate, with a high complication rate. And, I think all of this means that, and then of course, with the people who are supposed to get it, they're not really sure if they're going to have it covered. It changes one day. Right now, you need a prescription in 16 states, like you said, even if you're under the guidelines. So who knows when that will change? And that leads to a blanket of uncertainties, like a fog. So probably, an increase in hospitalizations in some group, increase in healthcare utilization, particularly for the kids who are the drivers of emergency room visits, even higher than adults over 65.
Yeah, and many people might be wondering, considering the expense, do I really need a shot? So going into the fall and into flu season and so on, I mean, what are experts like yourself saying?
Well, I think there are probably three main groups who I will continue to recommend very highly. Those who are 65 and older, that's because those are the people I'm seeing in the hospital right now when I'm seeing people with COVID. Those who are pregnant, regardless of if you have comorbidities, and those who are kids, particularly those 2 and under. The problem is whether or not those groups will be able to get the vaccine easily. I think everybody else will probably do fine. Of course, comorbidities like extreme immune compromise, I always worry about as well. But it's really the older, very immune compromised, and the very young, like flu, that are being affected.
Got you. Now, many people might not be too bothered, I guess, because we don't hear much about COVID these days. So where do things actually stand? Sort of, what are you seeing out there?
So right now we have COVID rising across the country, but as the years go by, we're seeing a fewer proportion of people hospitalized. But on the other hand, we are still seeing people hospitalized. Last year, we had about 50,000 deaths, which is very similar to influenza. So it's not like it's nothing or gone away. And I think it's really hard because we're existing in these two worlds where most people seem to be doing fine. But then when you go behind the walls of the hospital, you're taking care of people who are getting very sick still. Not a lot like in 2020, but still a number that shouldn't be there because we have all the tools to keep them out of the hospital.
quick question for you, because so many people still are confused, and with all the process with the CDC going on, it certainly has added to a lot of that chaos out there. What's your advice on who folks out there can turn to when they're looking for medical advice on this?
Well, the Kaiser Family Foundation survey still says that Americans trust their clinicians. So talk to your doctor. I think various states and coalitions, and of course, professional organizations are getting together right now to sort of, like in the early days of COVID, come up with their guidance as well. But at the end of the day, whether or not it will be paid for is going to make a big difference to Americans.
Yeah, absolutely right. Listen, all this has been a very valuable reminder for so many people out there. Peter Chin Hong, thank you so much for speaking with us.
Thanks so much, Kim.